News Channel 5 Network. This is Talk of the Town.
Millions of people have taken up pickleball in recent years because it's a low-impact sport. So it may surprise you to learn that pickleball injuries are on the rise. Let's find out what the problems are and how to prevent them from Dr. Nance, who's an orthopedic surgeon and a hand and wrist specialist. Great to see you. How are you doing today?
Thanks so much for having me, Meryl.
Okay, so why are we seeing so many injuries if pickleball is supposed to be low impact?
So pickleball, as you know, is super popular sport. LeBron James just bought a professional pickleball team. And while anyone can play pickleball, the majority of people who are playing are over the age of 55. So this is a cohort that has some unique risk factors that make them more susceptible to severe injuries. The first being they're more likely to have osteoporosis, which is a weakening of the bone. So if you were to take a fall, you're more likely to break your wrist than just, say, have a bone bruise. And the second factor is that as we get older, we lose the collagen in our soft tissues. So that means that our muscles are just not as pliable. And when you're doing all those quick motion pivoting movements during pickleball, you're more likely to sprain or strain a muscle. And if you've ever pulled a hamstring, you know how painful that can be.
Yeah. So you have some tips for preventing pickleball injuries, starting with the best kind of footwear to wear.
Absolutely. So this is a sport where you should not be showing up in your regular running shoes. You need to buy some proper tennis shoes. They have the right rubber sole and excellent high ankle support, and that's going to help prevent your ankle rolling and getting ankle sprains.
Great. What about stretching and hydrating?
So like any sport, proper stretching is absolutely crucial. Even if it's just 5 minutes, we recommend something called dynamic stretching, which is where you're stretching while moving. So imagine doing lunges while you're twisting your core to kind of stretch all your muscles. And then proper hydration. Hydration helps to prevent fatigue. When you're fatigued, your technique starts to break down, and that's when you're most likely to be injured. So staying hydrated will help prevent injuries that way.
All right, what's the right type of pickleball recovery? What do we do after we play?
So I recommend my patients to do things like yoga and Pilates. Jillian Gumbel has an amazing online course called Yoga for Athletes. This is really important in helping those muscles recover so we don't suffer from those strains and sprains.
Okay, good. If you do get hurt, how do you know when it's serious enough to see a doctor or maybe even an orthopedic surgeon?
Number one, if the bone looks like it's deformed, it's possible that it could be dislocated, and those have to be treated immediately. So go straight to the emergency room. The second is if you were to take a fall and it's painful to bear weight on your leg or on your arm, you may have a fracture, and that needs an x-ray. So that's also something that you should take care of immediately.
Okay. What are the most common kinds of injuries that you're seeing?
So I see, unfortunately, a lot of wrist fractures, and then also a lot of different muscle strains and sprains, a lot of low back injuries for when you're kind of diving for that shot in the kitchen. And again, we hope that a lot of these things can be prevented by proper stretching. But if something doesn't feel right, just go to your doctor and have it checked out.
Some great information. Sounds like you're a pickleball player, too, if you knew that the kitchen was part of the court.
I am. I have 2 tennis courts across the street from my home, and when we redid them, I actually had them paint pickleball lines in one of the court, and now I cannot get that tennis court back. It's been completely converted to a pickleball court.
Dr. Nance, thanks so much for being with us today. We appreciate it.
Thank you so much for having me.
You'll find a link to Dr. Nance's website on ours at newschannel5.com.